I ngā mana i ngā reo, i ngā karangataha maha I tau mai ki tēnei koe I whenā koe te katoa. So, my koha today is that I think I know a little bit about Whanau Ora. And I expect that all of you in the room know a hang of a lot about sexual health. So if I give you my koha, then your koha will be to consider how is it that you might be able to interpret this kaupapa? How is it that you might be able to generate a Whanau Ora mind? How is it that you might be able to institute this in terms of your policies, in terms of your strategies, in terms of your practices, and most importantly, by the end of your 2 days, in terms of your plans? So I wonder if, in fact, I'm talking to the converted. Maybe, maybe not. And I'm sure that many of you will have heard about Whanau Ora, and I hope it's simply not been about Winston Peters on the TV. Whanau Ora is, in fact, an inclusive interagency approach. I just realised I didn't have the little thing in. Is an inclusive interagency approach to providing health and social services to build capacity of all New Zealand families. It empowers whānau as a whole, rather than focusing separately on individual family members and their problems. This already may create a challenge for some of you in the room, particularly if your client or your point of reference is the individual. Whanau Ora looks to create a variety of different ways to influence a particular approach of working with whānau. It doesn't have a one-size-fits-all approach. It is deliberately designed to be flexible and to fit the needs, or the specific needs, of the whānau or the family that you're working with. The focus of Whanau Ora is for whānau to identify their own strengths, their own needs and priorities, and to participate in the development of solutions to the issues they face. And let me remind you that all whānau have strengths. Some whānau will come up with their own ways of improving their lives, while others may want to work alongside of NGO providers, of their marae, of their hapu, or of their iwi. Yet further whānau will require specialist Whanau Ora providers who are a collaboration of organisations who offer wraparound services tailored to their needs. They will generally work with a whānau navigator or a whānau champion who will assist them to identify their needs and assist them to develop a plan and broker access to a range of health and social services. I don't know if this is something quite new to you, but certainly it appears to be quite a different trend than the health and social services that I've grown up with in Aotearoa New Zealand. So let's look at the history of Whanau Ora. For many of you it may be a relatively recent approach, but I would like to say that for those of you who come from a health background, that you may well remember the Te Korowai Aroha report. You may also remember that two of the driving forces behind the Te Korowai Aroha report were Taranaki and Sir Mason Jury. And that in fact, if you look at the Te Korowai Aroha report, you will see that there was a strong emphasis on wanting to move towards a Whanau Ora approach. So really that was the first policy or document that we saw in Aotearoa New Zealand which encouraged this particular approach. The second was that in 2009 there was a task force who were tasked with in fact coming up with a framework which would look at how it was that health and social services, and might I add, we've added a few other ministries since, could change their particular approach and way of viewing their practice to have a much more whānau inclusive approach. This then led to the development of whānau-centred services. For many of you who are NGOs in your communities, who work in that public health arena, you will probably be aware that for the last a year and a half there's been this growing burgeon of the development of whānau-centred services. These are not necessarily about the creation of new services. However, what these are about is encouraging people to move away from that competitive silo approach to contracting and service delivery to a much more collaborative and cooperative approach. I'm going to have a little bit of a slide up soon, and it's going to tell you about we's. Not necessarily what your kids might remember. I'll give you a different interpretation. And then one of the things I'm going to talk about as well is what we call cross-ministry initiatives. So that while it is something that primarily has been centred within health and social services, it is now something that is being expanded further afield into other ministries. So, the task force report. Oh, go back. Here we go. So the task force were tasked with coming up with an evidence-based framework to look at strengthening whānau capabilities, to have an integrated approach of well-being, to ensure that we were focusing on collaborative relationships between agencies, and to ensure that relationships between government and community were broader than just a contractual situation. So they looked at the relevant literature, they looked at the experiences of both health and social service agencies, they analysed oral submissions received from 22 hui that they went to around the country, and over 100 written submissions from individuals and organisations. While the report initially focused on Māori whānau, I don't know if any of you used to watch the television at that period of time when the task force first came out, but when it was eventually accepted by government, there was a clear indication that this particular initiative needed to not just be exclusively for Māori whānau, but for all whānau. And while there is a clear centre in terms of socio-economic deprivation and all of the health statistics that we have, which suggests that our priority should be on Māori whānau, it is not exclusive to also looking at other whānau. So here were some of the common themes. The need for Whanau Ora to demonstrate a Māori heart, to ensure that local representation was evident in any decision making, to cut out the bureaucracy as much as possible. I'm not quite sure we've achieved that one. To ensure that there was sustainability and adequate resourcing for this particular initiative. Again, I'm not too sure if we've achieved that one, particularly in terms of what the government chose to contribute to this particular initiative. There needed to be a research and evaluation component, and we also needed to look at quality relationships between whānau providers and with iwi. So the report had a 5-part framework. The first was that there needed to be a whānau aspirational aim, there needed to be whānau principles, whānau outcome goals, whānau-centred services, and finally, they actually wanted to set up a Whanau Ora Trust, and for the whole initiative to not necessarily be run by a ministry, which of course it currently is, which is Te Korowai. However, watch this space. There is a current review of Whanau Ora and of Te Korowai, and it will be interesting to see if Whanau Ora remains within that ministry or whether it's set up in a different form away from government ministries. I particularly wanted to focus on the whānau outcome goals. And really that's why, the reason why I wanted to focus on whānau outcome goals is I think it does require quite a mind shift in terms of potentially how you do your job. I come from a social work profession where one of the ultimate goals is to do yourself out of a job. I'm not quite sure that we do that well in this country at the moment. But I think that Whanau Ora offers us the opportunity to no longer be sitting in the power position seat, but to be working alongside of whānau. And by that I mean that the goals for whānau outcomes are that whānau be self-managing. And I get to travel all around Rohe of the Western District of Te Taihauauru, and I see lots and lots of whānau who come and tell their stories about how they've moved from a position of dependency to suddenly feeling as though they are self-managing of their lives. There's a very strong emphasis on living healthy lifestyles, and that in turn may well link to your particular kaupapa or your particular focus that you're looking at in the next couple of days. There's also a focus on participating fully in society. And by that, we mean in every way. So that while it is an initiative which is funded primarily from several ministries, the push has been to also ensure that we make ministries like Inland Revenue, the Ministry of Education, the Ministry of Justice, in addition to the four ministries that are involved in this kaupapa. We're challenging them to come to the table to say that in order for people who participate in Whanau Ora in a fully conducive way, that they also need to understand this particular kaupapa. To be confidently participating in Te Ao Māori, to be economically secure and successfully involved in wealth creation, to be cohesive, resilient and nurturing. So what are some of the distinctive features of Whanau Ora? The first is that we are moving away from the individual as the point of referral, or that the individual may be the point of referral, but then the practice is about working with the whānau. And we'll have a little bit of a discussion about what whānau means in a couple of slides. So what we have seen is a two-pronged approach to the development of Whanau Ora. The first is the collaboration of services or agencies. Here in Palmerston North, for example, we have a collaboration of over 8 agencies that span from Dannevirke through to Palmerston North and out to Feilding and out even further into Halcombe, and then inclusive of Feilding right down into Ngati Raukawa, into Shannon and Foxton. So it's quite a big collaboration of health, social service and in fact education agencies who are part of the whānau-centred service here in this area. Are you aware of the whānau-centred services in your area? In addition, I said to you I'm going to talk a little bit more about we. Hold that thought, not right at this moment. The other thing is that for any of you who know about we, and as we travel around communities, they've been saying to us, well, which Whanau Ora are you? And we've been going, what do you mean? And they say, oh, well, the Ministry of Health comes and talks about their Whanau Ora, and the Ministry of Social Development, they come and talk about their Whanau Ora. And now, every Tom, Dick and Harriet agency are telling us that they have a Whanau Ora approach. Well, we're not quite sure what is Whanau Ora. So there's a little bit of confusion out there as people start to come on board with looking at what Whanau Ora means for them, and how is it that they then work with that in their particular communities. So what I need to say to you is that I'm here representing the results as a result of the task force report and the Whanau Ora initiative headed by Te Puri Tōkiri. However, when you get back into your communities, be aware that there are other Whanau Ora approaches. A good example of that in this community is that our PHO, Compass Health, have a Whanau Ora approach and are already rolling that out in terms of initiatives in this community. So that gives you another example of how other ministries are also choosing to take on board Whanau Ora. I mentioned to you that I think Whanau Ora is a mindset. It's a way of thinking. I don't think it's just about a practice. I don't think it's something that you practice from 9 and then when you go home at 5, you leave it at the door. It's about a philosophy, because what we know is that you do what you do because you have values and you have a fundamental philosophy that makes you passionate about the work that you're involved in. Well, the challenge here today is how is it that we also get you to have a Whanau Ora mindset? How is it that we get you to critically analyse your practice with a view that maybe one of the ways in which you could be more successfully operating is by including a Whanau Ora approach? And therefore, that means that you have to consider what that means. What does that mean for your particular area of practice? Because it will differ in the hospital than it will outside in the community. You also need to consider what that might mean for your particular group as a whole. Do you want to have a particular Whanau Ora strategy? And it's one of the questions that I will leave you with. So at the moment, in terms of the whānau-centred services, we have 34 collectives in this country who represent 180 health and social service providers. And they are currently looking at how to develop and deliver a collaborative approach to working with whānau. I mentioned to you that there are key ministries involved. Te Puni Kōkiri, or the Ministry of Māori Development, is the ministry that actually administers Whanau Ora. In addition, there's the Ministry of Health, and I'm sure that many of you will have a relationship with that particular ministry. There's also the Ministry of Social Development, and most recently, and when I say most recently, probably in the last month, the Ministry of Education have also committed themselves to becoming a part of this particular initiative and to start quite specifically with early childhood initiatives. The CEs, or the chief executives of all of these ministries, sit on the governance group, the national governance group, which consider some of the broader strategies and government responses and government pressures around Whanau Ora. Now, you have heard in Anne's brief introduction about myself that I sit on one of the regional leadership groups for Whanau Ora. These groups, there are 10 in total, are situated all around the country, and it's their job to be the interface between the national governance group and our communities, between the government ministries and those agencies that are currently struggling to consider what does Whanau Ora mean and what does it look like, what does it feel like, what does it smell like. So our responsibility is to spend a lot of time meeting with community, and I've had the wonderful luxury in the last year and a half of visiting all of my marae that I have genealogical links with, of meeting in very remote communities, like up the Wanganui River, if any of you are familiar with the Wanganui River, in Taihapi. Now come on, all of you know where Taihapi is, except for maybe our international visitors. Under the mountain of Mount Ruapehu in places, in fact this week I was in Taranaki, and then some of our bigger centres like here in Palmerston North, in New Plymouth and in Wanganui. So every month we go and we meet with communities to ascertain what are their issues in terms of Whanau Ora and how is it that these ministries could be best meeting their needs. So we link the community with these government agencies, because it may be that these government agencies can respond to the particular issues that they're talking about. I'll give you an example. One woman in Ohakune, she said, my son is the first in my family to attend university, and we've sent him all the way from Ohakune to Wellington, but we have some issues around how it is that we support him. And so our representative from the Ministry of Social Development was able to say, I'll meet with you afterwards and we'll look at some strategies and ways in which we can support your whānau member. I'm just giving some really practical little examples. So we hear about the community issues and we hear about their stories. We also review all of the funding applications that come in from whānau, that come in from NGO providers. When I can think of one particular provider that I think might have some interest with you, and that was a doctor's surgery that also was connected to being involved in the local PHO in their particular community, and also ran the Strengthening Families initiative in their community. And so one of their applications was that they wanted to work with 15 families in their area and to come up with Whanau Ora plans. So we report to the governance group, who in turn reports to the minister, who's Tony Anaturia. We also link whānau to the applications with Te Puni Kōkiri, and we assist in developing regional strategic relationships. And I think that as regional leadership groups, we owe it to our communities to be that link between their issues and the ministries and government. So let's just look at whānau-centred services. Remember, these are the 35 collectives of over 180 agencies around the country. Not easy, when in fact we've spent the last decade or so, operating from a perspective of being quite competitive, operating in silo environments, to suddenly actually, in some instances, we've forced them to have collaborative relationships, to actually be saying, we now want you to be working together. We want you to be working with people who just last week you may not have seen as your friends. And we want you to be looking at how you can best meet the needs of whānau who live in your community. So that's what I mean by collaborations of community organisations. In order to be more effective, because we're not talking about any new money, what we're talking about is reconfiguring their current contracts, and potentially moving into what's called an integrated contract. Any of you know about those integrated contracts? Not easy to work with, because this is about, in the first instance, trying to get, and we're just working with Ministry of Social Development contracts at this stage, but we now have some of those collective providers who've also started looking at integrated contracts with health, with justice, and with education, to eventually come up with a wraparound service. And the way in which they do that is to create whānau navigators, and they also have action research sitting alongside of them. We rolled that particular arm of Whanau Ora out first, and to be honest, I wonder if we should have done it the other way, and we should have rolled out Whanau Integration, Innovation and Engagement Fund, also known as WE, or as some people would say, an acronym that represents we and not I, to look at the opportunity for whānau, and whānau meaning whatever you want it to mean, primarily whānau from a genealogical perspective, but also whānau who might say, we're a sporting club, but actually everybody in our sporting club comes from this town, and we all have genealogical connections to each other. So the opportunity for families to apply for funding, to develop a plan in the first instance. They get given a certain amount of funding to just develop their plan. I was reading on the TPK website in preparation for this, and there was a family who only comprised of mum, dad and the 4 siblings at this stage, but their goal was to expand who it was that they wanted to have from their whānau by going and creating relationships in their whānau. So it can be a whānau of whakapapa or genealogy, or a whānau of kaupapa. And I think that for those of you here who work in your terrain, that you might see both options as having potential in terms of families or initiatives that you work with. So the focus of Whanau Ora is for whānau to identify their own strengths, needs and priorities, and to participate in the development of solutions to the issues they may face. Whanau Ora is about transformative change as a whānau, as a provider, and at a government agency level. Now, my time has quickly run out, so I wanted to just talk with you very briefly about the fact that I looked up on your website and I saw this as a description. Sexual health is often neglected in the public health policy, and the aim of the conference is to raise its status along with raising the bar for standards of service provision. We hope that those working in both clinical and health promotion roles in a range of practice settings will gain knowledge to improve the coordination and quality of sexual health services for all New Zealanders. So this is the link. This is the connection, the line of connection. Because here are some questions that I leave you with. I just started to sow the seed today. Have I got you interested enough so that you want to know more about Whanau Ora? Have I got you to a place where you think this might be a collaborative approach, whether we work in a hospital or work out in the community, that we could strategically be looking at in terms of our future direction? So, are you interested in being a part of the Whanau Ora initiative? What does this mean that you need to do? How might this differ from the range of practitioners that you have and the range of practice that you are currently involved in? What is your strategy? What is your plan? I met with Anne in preparation for this conference. Sorry, Anne. And I said to her, for example, does your association have in its vision a connection with the Treaty of Waitangi? Maybe that's your starting place. Because then that allows you to have meaningful relationships and meaningful conversations around looking at Whanau Ora. I finish with this. Ko te pai tāwhiti whaia kia tata, ko te pai tata whakamaua kia tēnā. Seek out those distant horizons and pull them closer. Hold steadfast to the ones that you have already attained. I wonder if for many of you in the room, this might still feel like a stranger in your midst. How is it that you bring that thing that is at a distance, that may only be at a vision? How is it that you bring it close? How is it that you have a meaningful conversation amongst yourselves, and then a meaningful conversation with the likes of the tangata whenua, with the likes of the Māori providers, with the likes of your Māori practitioners, with a view of creating a particular whānau ora approach? Tēnā koutou katoa.